version of the Ssb Antibody Test write-up, expanded point by point with full explanations for each section. This is written in a style suitable for both patient education and academic or laboratory reference use. Anti-Ssb Antibody Test. Matter 1. Introduction. The Anti-Ssb Antibody Test is a specialized blood test that detects the presence of antibodies directed against the LA, also known as Ssb, protein. This protein is a small nuclear RNA binding protein involved in the processing of RNA molecules within the cell nucleus. When the body's immune system mistakenly identifies the LA protein as a foreign substance, it produces autoantibodies, specifically anti-Ssb antibodies, against it. The presence of these antibodies is strongly associated with autoimmune connective tissue diseases, particularly Sjögren syndrome and systemic lupus erythematosus, SLE. This test is an important diagnostic aid in identifying autoimmune disorders where the immune system attacks the body's own tissues, leading to chronic inflammation and tissue damage. Number 2. Definition. Anti-Ssb antibodies are autoantibodies that target the Ssb antigen, a ribonucleoprotein complex found in the nucleus of cells. ELA, or Ssb, stands for small RNA binding nuclear antigen B. These antibodies are a subclass of extractable nuclear antigens, ENAs, and are usually measured as part of an ENA panel. A positive anti-Ssb antibody test suggests an autoimmune response against the La antigen, often seen in patients with Sjögren syndrome or lupus erythematosus. 3. Indications. Doctors order the anti-Ssb test when an autoimmune disease is suspected, especially if the patient presents with dry eyes and dry mouth, xerostomia and xerophthalmia, hallmark symptoms of Sjögren syndrome, joint pain, fatigue or swelling, skin rashes, especially those triggered by sunlight, unexplained fever or weakness, swelling of salivary or lacrimal glands, pregnant women with a history of autoimmune disease to assess fetal risk of neonatal lupus or congenital heart block. It is also indicated when ANA, anti-nuclear antibody, or anti-Rho SSA antibody tests are positive. Number 4. Used. For the test serves several clinical and diagnostic purposes. Diagnosing Sjögren syndrome, primary or secondary. Supporting diagnosis of systemic lupus erythematosus, SLE. Differentiating connective tissue diseases such as lupus, rheumatoid arthritis, and mixed connective tissue disease. Evaluating autoimmune disease activity or progression. Risk assessment during pregnancy, neonatal lupus congenital heart block. Nash 5. Why do need of this test? You may need this test if your doctor suspects an autoimmune disorder based on your symptoms, medical history, or preliminary lab findings. Specific reasons include to confirm the diagnosis of Sjögren syndrome or lupus, to identify the specific autoantibody pattern in autoimmune diseases, to predict the likelihood of certain complications, e.g., neonatal lupus, to guide treatment and long-term management of autoimmune disease, to monitor disease progression or response to therapy. Number 6. What happens during the test? The procedure is straightforward and similar to any routine blood draw. 1. A healthcare professional cleans the skin with an antiseptic. 2. A needle is inserted into a vein in your arm, usually in the inner elbow area. 3. A blood sample, a few milliliters, is collected into a sterile tube. 4. The sample is sent to a clinical immunology laboratory. 5. Laboratory analysis is performed using ELIA, enzyme-linked immunosorbent assay, immunoblotting, or indirect immunofluorescence, EF methods. 6. The test identifies whether anti-Ssb antibodies are present and measures their levels, qualitatively or semi-quantitatively. The procedure takes about 5 to 10 minutes, and the discomfort is minimal. Number 7. How long for my results? Turnaround time varies depending on the lab, but generally, standard testing, 2 to 5 working days. Comprehensive autoimmune panel, up to 7 working days. Urgent cases may get results faster if the test is prioritized. 8. Prepare for this test. Generally, no special preparation is required. However, you may be advised to inform your doctor about all medications, including immunosuppressants or corticosteroids, as these can influence antibody levels. Avoid intense stress or infection before the test, as immune activation can cause transient changes. Fasting is not necessary. Stay hydrated and relaxed before the blood draw. 9. Risks. To the test itself carries minimal risks, typical of any venipuncture procedure, mild pain or bruising at the puncture site, slight bleeding, lightheadedness or dizziness, rare, Infection at puncture site, very rare. Most people experience no complications. Number 10. Normal values. Normal or reference ranges may vary by laboratory, but typically negative, non-reactive, no anti-Ssb antibodies detected. Positive reactive anti-Ssb antibodies detected, suggesting autoimmune activity. Results are often expressed as negative 20 milliliter, equivocal 20 to 25 uni, positive 25 milli. Always interpret these values in context with other autoimmune tests and clinical findings. NARP 11. Interpretation of results. A. Negative result. No detectable anti-Ssb antibodies. Usually indicates no autoimmune activity involving the La antigen. Does not completely rule out autoimmune disease. Some patients may have other antibodies such as anti-Ro SSA or ANA. B. Positive result. A positive test may indicate one or more of the following conditions. Primary Sjögren syndrome, anti-La Ssb antibodies present in chest in 60 to 70% of cases. Secondary Sjögren syndrome, in combination with lupus or rheumatoid arthritis. Systemic lupus erythematosus, SLE 15 to 25% of lupus patients are positive. Neonatal lupus in infants born to mothers with anti-Ro SSA and anti-La Ssb antibodies. Other connective tissue diseases occasionally. Interpretation. Tip, a combination of anti-Ro SSA and anti-La Ssb positivity is more specific for Sjögren syndrome than anti-Ro SSA alone. Number 12. Factors affecting results. Several factors can influence the accuracy or interpretation of test results. Laboratory method variability, different assay sensitivities, recent infections can cause temporary autoantibody production. Medications, e.g. corticosteroids, immunosuppressants, may suppress antibody levels. Sample handling errors, overlapping autoimmune syndromes, multiple antibodies present. Therefore, results must always be interpreted by a qualified clinician in conjunction with the patient's history and other lab data. Number 13. Clinical significance. The clinical significance of anti-La Ssb antibodies lies in their diagnostic and prognostic value. Sjögren syndrome, strongly associated and diagnostic marker. Lupus erythematosus helps identify subsets of lupus patients at risk for photosensitivity or cutaneous lesions. Pregnancy. Detection in mothers is crucial to monitor the fetus for congenital heart block or neonatal lupus. Disease management, used to track autoimmune disease progression and assess treatment response. Overlap syndromes, helps distinguish overlapping autoimmune conditions when symptoms are nonspecific. Number 14. No more. Anti-La Ssb antibodies often coexist with anti-Ro SSA antibodies. These antibodies target RNA-binding proteins involved in RNA processing and transcription termination. Their presence indicates B-cell hyperactivity and a loss of immune tolerance. In clinical practice, the anti-La Ssb test is typically ordered as part of an extractable nuclear antigen (ENA) panel. When both anti-Ro and anti-La antibodies are positive, Sjögren syndrome is the most likely diagnosis. In neonatal lupus, maternal antibodies can cross the placenta, affecting the fetus's skin or heart conduction system. Number 15. Conclusion. The anti-La Ssb antibody test is an essential tool in diagnosing and managing autoimmune connective tissue diseases, especially Sjögren syndrome and systemic lupus erythematosus. It detects antibodies that indicate the immune system's abnormal response against its own nuclear proteins. While a positive result supports the diagnosis of an autoimmune disorder, it must always be interpreted alongside clinical findings, patient history, and other antibody tests, like anti-Ro SSA and ANA. Early and accurate detection through this test helps clinicians initiate timely treatment, prevent complications, and improve long-term outcomes for patients with autoimmune diseases. Thank you. Have a nice day.